Question number 241. What is the common side effect of opioid analgesics? So option A, diarrhea, option B, constipation, option C, hyperactivity, and option D, weight loss. So option B, constipation is correct answer. So some common side effect of opioids include the nausea, constipation, vomiting, drowsiness, dizziness, pruritus, and nausea. Question 242. So which nursing intervention is important for patient with hypertension? So option A, administering the anti-hypertensive medication. Option B, educate the patient about low sodium diet and lifestyle changes. Option C, increasing a high sodium diet. And option D, restricting the fluid intake. So option B, educate the patient regarding the low sodium diet and lifestyle changes is correct answer. Question 243. So how should a nurse handle a needle stick injury? Option A, ignore it if doesn't hurt. And option B, report the incident immediately and follow the post-exposure protocol. Option C, wait to see if symptoms develop. And option D, treat the wounds with alcohol. So option B, report the incident immediately and follow the post-exposure protocol is correct answer. So here, how to handle the needle stick injury? First, don't panic, and second, don't squeeze the injured size, and the thirdly, wash with soap and water immediately, and the next, report to casualty, and the last one, receive the appropriate treatment within the 72 hours. Question number 244. Which intervention is most important for the patient with a fever? So option A, administering the antipyretic. Option B, increasing the fluid intake. Option C, providing a cold compression, and option D, monitoring the heart rate. So option D, increasing the fluid intake to prevent the dehydration is correct answer. So why fluid intake is important? So fluid intake is critical during the fever to prevent from the dehydration, which is caused by the increased body temperature, sweating, and rapid breathing. So fluid help to regulate the body temperature, replenish the loss of the electrolyte, and support the immune function of patient. Question 245. So what is the key sign of dehydration in patient? So option A, hypertension. Option B, dry mucous membrane and decreased urine output. Option C, bradycardia. And option D, hyperthermia. So option B, dry mucous membrane and decreased urine output is correct answer. So some other common side effect signs of dehydration are extreme thirst, dark yellow or amber color urine, dry mouth, fatigue, dizziness, and the reduced urination. Question 246. What is the primary role of insulin in the body? So option A, to digest carbohydrate. Option B, to regulate the blood glucose level. Option C, to aid in the protein synthesis. And option D, to maintain the fluid balance. So option B, to regulate the blood glucose level is correct answer, because primary function is to regulate the blood sugar by acting as a key, and that unblock the cell to absorb the glucose for the energy and thereby lowering the blood glucose level. Question number 247. So what is the most effective way to prevent the spread of infection in healthcare settings? So option A, wearing gloves. Option B, hand hygiene. Option C, using hand sanitizer, and option D, wearing mask. So option B, hand hygiene is correct answer, because hands are the main pathway for the germs to transmission during the healthcare. So hand hygiene is therefore the most important measure to avoid the transmission of the harmful germs and prevent the healthcare associated infection. Question number 248. When suctioning the oropharynx, so which of the following is the proper position for the patient? So option A, prone. Option B, supine. Option C, semi-follower. And option D, Trendelenburg. So option C, semi-follower position is correct answer. Question number 249. To prevent the headache after the spinal anesthesia, so patient should be positioned. Option A, semi-follower. Option B, flat on the bed for the 6 to 8 hours. Option C, prone position, and option D, modified Trendelenburg. So option B, flat on the bed for 6 to 8 hours is correct answer, because spinal anesthesia can cause the headache. So by keeping patient flat on the bed for at least 6 to 8 hours can prevent from headache. So question 250. The day after an amputation, the client begin to hemorrhage from his stump. So what action should the nurse take first? So option A, apply a pressure dressing to the stump. Option B, place a tourniquet above the stump. Option C, notify the physician. And option D, apply an ice pack to the stump. So option B, place a tourniquet above the stump is correct answer, because it will help to stop the bleeding immediately. Question number 251. A nurse is assessing a patient with pneumonia. So patient has normal saline infusion at 75 ml per hour in the right arm. So the nurse noticed the swelling and the coolness around the insertion site, and the patient is complaining of mild discomfort. So which of the following action should the nurse do first? So option A, apply the warm moist compression and reassess in the 15 minutes. Option B, find another intravenous access in the other arm. And option C, stop the infusion immediately and remove the catheter. And option D, start the appropriate antibiotic to prevent infection. So option C, we need to immediately stop the infusion and to remove the catheter. Question number 252. Which of the following could adversely affect the function of pacemaker? Option A, hair dryer. Option B, electrical razor. Option C, television. And option D, electrical mixer. So option B, electrical razor is correct answer. Question 253. A 37-year-old woman presented to the emergency room with a complaint of symptomatic bradycardia. So appropriate nursing intervention including the establishing the intravenous access. So what is the possible drug to be administered in the IV solution? So option A, digoxin. Option B, atropine. Option C, anticoagulant. And option D, a calcium channel blocker. So option B, atropine is correct answer, because atropine is a first line medicine, and so which help to treat the symptomatic bradycardia. Question 254. A 12-year-old boy was brought to the emergency department with respiratory arrest and due to the drowning. So cardiac resuscitation was performed. So what is the major complication that might happen if the patient is not treated after drowning quickly? So option A, sepsis. Option B, alkalosis. Option C, acidosis. And option D, hypothermia. So option C, acidosis is a correct answer, because acidosis occur after drowning. So primarily due to the severe prolonged hypoxia and due to hypercapnia, so which result from interruption of the breathing and the aspiration of water. Question 255. A patient admitted to emergency room with the alcohol withdrawal syndrome. So a nurse performed the physical examination. So which of the following symptoms are expected? So option A, hypotension and bradycardia. Option B, deep sleep and unconsciousness. Option C, uncontrollable fear and tremor. And option D, decreased body temperature. So option C is correct answer. So some other symptoms are anxiety, trembling, irritability, sweating, loss of appetite, and nausea and vomitings. Question 256. A patient admitted to critical care unit with a diabetic ketoacidosis. So which of the following nursing diagnosis takes priority? Option A, deficit fluid volume secondary to hyperglycemia. Option B, deficit knowledge of cause and prevention. Option C, imbalanced nutrition related to hyperglycemic state. And option D, risk of infections secondary to weak immune system. So option A, deficit fluid volume secondary to hyperglycemia is correct answer, because as you know, diabetic ketoacidosis is a life-threatening emergency complication of type 1 diabetes occurring when severe insulin deficiency causes the body to turn fat for energy and producing ketones body. Question number 257. A patient has multiple sclerosis and complain of overwhelming fatigue. So what counseling should be given here? So option A, conserve energy during activity of daily living. Option B, increase muscle strength and through aerobic exercises. And option C, ignore fatigue and keep working. And option D, increase early afternoon intake of caffeine. So option A, conserve energy during activity of daily living is correct answer. Question number 258. A nurse is caring for the patient diagnosed with acute pancreatitis. So the abdominal X-ray revealed the evidence of pancreatic calcification. So there is no sign of biliary disease. So what would the nurse most likely instruct the patient to do? Option A, consume a high protein diet. Option B, gradually increase dietary fiber. Option C, avoid ingestion of alcohol beverages. And option D, limit the activities when the patient is fatigued. So option C, avoid ingestion of alcoholic beverages is correct answer. Question number 259. Which of the following discharge planning instruction takes priority in the patient with congestive heart failure? Option A, recognizing sign and symptom that require immediate medical attention. Option B, maintaining the low cholesterol, low sodium and low potassium diet. Option C, the importance of remaining physically active. And option D, the importance of drinking plenty of fluid. So option A, recognizing sign and symptom that require immediate medical attention is correct answer. Question number 260. A patient with end-stage renal disease is having a breathing difficulty due to the abdominal aside. So the nurse should anticipate which of the following procedure to relieve the aside. Option A, paracensis. Option B, hemodialysis. Option C, amniocensis. And option D, lumbar puncture. So definitely to relieve from the aside, we need to perform the paracensis. So option A is correct answer.